Hi, this is Pharmacology 3021 and we will provide some information about a class of drugs that can be used to treat local inflammation, asthma, allergies, autoimmune diseases, sepsis and other disorders. But what is this class of drug? It is glucocorticoids. Firstly, we need to understand how does glucocorticoids work? Glucocorticoids need to be lipid-soluble to pass through the plasmatic membrane to bind the receptor where they act inside the cell. There are two major mechanisms in which the glucocorticoids work. The transactivation occurs with activated glucocorticoid receptors binds to glucocorticoid response elements in the promoter region of the genes to increase the anti-inflammatory proteins. And the transrepression is the mechanism that works by the inactivation of pro-inflammatory transcription factors F and F-kappa beta, decreasing the pro-inflammatory proteins. So, the inflammation cascade is related to the arachidonic acid being transformed by COX in prostaglandins and thromboxane and by lipoxygenases in lipoxins and leukotrienes, responsible by the inflammatory effect. But where the glucocorticoids act, they are responsible for inhibits the synthesis and activity of phospholipase A2, decreasing the amount of arachidonic acid produced. Another action is to induce the production of annexin 1 that inhibits the effect of leukocytes traffic and inhibiting the synthesis of COX enzyme. All these actions combined aim to reduce the production of cytosines, vasodilation, edema, leukocyte activity, and eicosanoids, and the aim of this is to reduce the inflammation process. The axis hypothalamus-pituitary-adrenal involves the negative feedback of the cortisol on the hypothalamus and pituitary. And why this is relevant? We are studying glucocorticoids. Because under the treatment with glucocorticoids, it will occur a negative feedback on the hypothalamus and pituitary. If the use of the drug is suspended abruptly, this can lead to adrenal insufficiency and Addison disease. The adverse effects can be observed in the classic phenotype of Cushing syndrome. The chronic use of high dose of glucocorticoids can lead to hypertension, muscular tissue and adipocyte catabolism and fat deposition in the central area of the body and face, characterized by moon face. In addition, can lead to cataract, red striation, thin skin and slow healing wound, osteoporosis, bruise because of the capillary fragility, and petechias. In addition, it is important to highlight the immunosuppressant role of the corticosteroids, increasing the risk of infections. The high concentration of glucocorticoids generate a mineralocorticoid effect. It will act on the distal portion of the nephron, increasing the reabsorption of sodium and water retention and resulting in potassium loss. So this action can cause hypokalemic. So it is necessary to be cautious when receiving diuretics as furosemide or hydrochlorothiazide because they can lead to severe hypokalemic because both drugs lead to potassium loss. The metabolism of glucocorticoids involves the enzyme CYP3A4. In light of this, the drugs metabolized by these enzymes, as barbiturates, carbamazepine, and phenytoin, need to be adjusted considering the availability of the glucocorticoids in the plasma and the availability of the drugs in the plasma. To sum up, the glucocorticoids act by increasing the anti-inflammatory factors and decreasing the pro-inflammatory factors. The drug cannot be removed at once and it should be done gradually, reducing the dose and spacing days. The main side effect is related to Cushing syndrome, immune suppression, and mineralocorticoid effect. So, attention when prescribing diuretics or CYP3A4 inducers when in treatment with glucocorticoids, okay?
bite that